The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
My name is Juan Contreras. I'm 50 years old. I work for Home Depot, and I live here in Glen High, Texas. With acid reflux, I had a lot of pain under my abdominal, a lot of bloating, a lot of heartburn. I was in extreme pain most of the time. Acid reflux was affecting my job real bad. I mean, there was times where I could work a few hours, and once the acid reflux would come up, I'd have to leave, and I was missing a lot of work. All the over-the-counter medications and the prescriptions they would give me were not suitable for my body. I mean, I would get all kinds of reactions and side effects and stuff like that, so I couldn't take them. I saw an ad in the paper that they could get rid of my acid reflux without medication. So I went to see the doctor. I told him all the symptoms, and he checked. They went in there with a camera and checked, and they said my esophagus was real bad and that I needed, that procedure, that TIF. It was a very simple procedure. A week after the TIF procedure, I went right to work and had no problems, have no complications, went straight to work. Before I had my surgery, the TIF procedure, the acid reflux was so bad, I couldn't even walk my dog because I was afraid of getting pain out there. So now I'd be walking my dog every day, and I don't be worried about having the acid reflux pain. I can go to any restaurant that I want and have all the spicy food that I want and have no acid reflux. And I'm not afraid to go and eat. I recommend the TIF procedure to anyone that's having problems with acid reflux. I have recommended it to friends.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERD help.com, and use the physician locator.